Good evening, my name is Piyush Ranjan. My student ID is 1649182237, and I'm gonna perform head to toe assessment video on my client. So I'm gonna ask you to give a 360 view of the room. Thank you. So my name is Piyush Ranjan, and I'm your registered nurse for today. So doctor has prescribed a head to toe assessment for you. So can I ask your name?
My name is Amrinder Singh.
And can I ask your date of birth?
My date of birth is 8 August 2000.
Oh, thank you so much. Now I'm gonna assess your head to toe examination. So for that, I'm gonna give you some privacy and wash my hand. Thank you. So first of all, I'm gonna ask you what's the year?
It is 2025.
Thank you. So and what city are we currently in?
We are in Brampton.
Thank you. And who is the Prime Minister of Canada?
Justin Trudeau.
Thank you. So first of all, I'm gonna assess your parla. Okay. So I'm gonna assess the diameter of your pupils. The diameter of your pupils are symmetrical, and then I'm gonna assess the reaction to the light of your pupils. Is it okay if I put some light in your eye?
Yeah, sure.
Thank you. Thank you. So your pupil are reactive to light, which is a normal thing. And next, I'm gonna assess accommodation of your eye. For that, I'm gonna ask you to look at this one, and I'm gonna take it near to the bridge of your nose. Yeah. So your eyes are accommodative, and then I'm gonna ask you to stand up. Can you please do like this? Thank you. And can you please close your eyes and count to 10?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Thank you so much. You can sit down. Thank you so much. Can you please smile for me? Can you please raise your eyebrows? Thank you so much. So as we can see, there is no facial drooping, and there is. Can you repeat after me? Today is Sunday.
Today is Sunday.
Yeah, and there is no speech slurring, and the neurological assessment is done. So next is respiratory assessment. I'm gonna ask you to turn this way, please. So now I'm gonna ask you to breathe 2 times. Deep breathe. Okay. Start. Again. Thank you so much. So the chest size is chest is symmetrical, and respirations are normal. So now I'm gonna check the respiratory points in the front. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Thank you. Now I'm gonna ask you to run now. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. Thank you so much. Your breathing is normal, and there is no adventitious sounds such as muffled sounds and any wheezing sounds. And the respiratory assessment is done. So now I'm gonna move on to the cardiac assessment. So for that, I'm gonna assess the aortic point, which is located. This is the clavicle bone, and below this there is first rib, and there is second rib, and below the second rib there is second intercostal space, and this is the aortic point. Parallel to this is pulmonic point, and yeah, this is first rib, second intercostal space. This is the aortic point, and this is pulmonic point. And at the third intercostal space, there is Erb's point, and between the fourth and fifth intercostal space, there is within the fourth and fifth there is a tricuspid valve, and uh, below the mid clavicle line and fifth intercostal space there is apical pulse. So now I'm gonna count your pulse for 30 seconds. Okay, so I have assessed your pulse. Your pulse is 84 beats per minute, which is considered to be within the normal range, and there is no other problems apart from anything. So the next I'm gonna do abdominal assessment. So I'm gonna ask you to lie down, please. Thank you. So I'm gonna check the symmetry of the abdomen. Yeah, it is symmetrical. So I'm gonna check counter at the end of the feet. Yeah, the counter is flat. So first of all, I'm gonna inspect this abdomen. As I can see, there is no bluish discoloration. And next we are gonna do auscultation. So are you experiencing any pain? No? Okay, thank you. The bowel sounds are normal, and next I'm gonna do palpitations. Are you having any pain? No. No. Okay. So next I'm gonna do percussion. Okay. So there is no no tympani sound, and there is no bulging in the abdomen area, and the abdominal, and there is also no any bluish discoloration of the skin. The abdominal assessment is done. Okay, please sit up. So next I'm gonna do musculoskeletal and integumentary system assessment. So for that, I'm gonna ask you to raise your arms. So I'm gonna put some pressure on it. You have to resist it. Okay. Thank you. So same goes for the legs. Thank you so much. So the musculoskeletal assessment is normal, and for the integumentary system, I'm gonna ask you to raise your arm. So the skin turgor is okay, normal, and there is the hydration is normal, and I'm gonna ask you to give me your hand. I'm gonna check the capillary system. Yeah, it is refilled in within 1 second, which is considered to be normal. So next, I'm gonna assess your pulses. So first of all, I'm gonna assess your carotid pulse. So which is located below the jaw at the angle between sternocleidomastoid muscle and larynx. Yeah, the carotid pulse is normal. So I'm gonna check your thank you. So next is dorsalis pedis, which is located at the front of at the ankle in the front. Thank you. The next is tibiofibial. so much. The pulses are normal, and there is no any kind of bluish discoloration on arms or legs, and rest is fine. So I have completed my head to toe assessment, and now I'm gonna ask my friend to give a 360 view of the room. Thank you so much.